Chapter 5. Self-Diagnosis. How to examine yourself and avoid diseases. Anyone who believes that anything can be suited to everyone is a great fool, because medicine is practiced not on mankind in general, but on every individual in particular. Henry de Mondeville. Usually people go to their doctors to be examined after particular symptoms start manifesting, or when they feel really sick. The procedure most likely will be as follows: symptoms, diagnosis, treatment, follow-up. However, in Ayurveda, the diagnosis may be defined as the continuous at the moment interactions between the doshas and the bodily tissues. This is because it is believed that this is how disease manifests itself. A daily observation, awareness, and monitoring of the radial pulse, tongue, skin, etc. is a very effective practice when it comes to disease prevention and also is a tool for self-diagnosis. The following are guidelines that will serve as aid in the diagnosis and prevention of diseases. Examination of the radial pulse. There are 7 pulse points as seen in the diagram above. They are the temporal, above the temple, carotid, side of the neck above the clavicle, brachial, inside of the arm above the elbow, radial, on the wrist, femoral, on the inside of the front leg, posterior tibial, behind the ankle, and dorsalis pedis, top of the foot. One of them, the radial pulse found at one's wrist in one's body, is a good diagnostic point to at least have an idea on the state of one's body. It is important to note that one's pulse should not be monitored after these events, as one may get different or above normal results. While hungry, while taking a bath, after consummation, after taking food or alcohol, after hard physical labor, after massage and urination. It is best to monitor one's pulse in the morning after waking up or during times when one's relaxed, rested, and not at the peak of an emotional turmoil. The status of the body organs in one's constitution can be identified when one is knowledgeable in the examination of radial pulse. The beats that one feels in pulsation not only indicates the beating of the heart, but also gives an overview on the important meridians that connects pranic currents inside the body. When doing an examination of the pulse, know that each finger rests on a meridian that corresponds to a particular body organ. To illustrate, the index finger gives an indication of the status of the lungs, the middle finger of the intestines, and the ring finger of the kidneys. Making it a habit to check one's pulse and the changes that happens to it is an effective technique in self-diagnosis. Facial diagnosis. The face can be considered a mirror of the soul. Thus, diseases, at most times, reveal their ugly heads in one's face. Each line or spot in one's face can be an indication of what is going on in one's body. Eyebrows, especially those with the vertical lines, may indicate repressed emotions are being stored in the liver. In the forehead, horizontal wrinkling could mean anxiety attacks and deep-seated worries, whereas a vertical line between the eyebrows may mean that the spleen is holding a lot of negative emotions. The kidneys may indicate impairment through dark and puffy eyes. A discolored cheeks and nose may indicate something is wrong in one's kidneys and that the body is lacking folic acid and iron. In general, based on constitutions, a Vata person does not have the ability to store fat, so his face may look sunken and his nose crooked. A Kapha tends to accumulate water and most of the time has a puffy face and a blunt nose. A Pitta tends to have a good appetite and his face may look plump while his nose sharp. Tongue diagnosis. The tongue is the organ for taste and speech. It is vital for speech as it is integral to form sounds and makes it possible to convey ideas, feelings, thoughts, and concepts. When the tongue is wet, it is able to perceive taste. When it is dry, it loses its ability to do so. It is important to make it a habit to check one's tongue, as it reveals a lot of what's happening inside the body. The factors to consider when examining the tongue are the following: shape, color, size, margins, dampness, and color. The color yellowish may indicate bile in the gallbladder or liver disorder. Its paleness is observed. Problems in the blood may be considered. If the tongue is bluish and one has not eaten anything of bluish color, the heart ailment may be present. Teeth impressions in the tongue indicate intestinal disorders. Usually coated tongues are indications of toxin overload in the body. Moreover, if one has observed a line in the middle which is quite impressed, it may indicate that emotions are being suppressed, while a curved line may mean a spinal problem. Lip diagnosis. Lips that are rough and chapped usually indicates dehydration and signals problems in the Vata dosha. Tremors and shaking of the lips may indicate anxiety attacks and nervousness. Pale lips are usually an indication of anemia or problems in the blood. Brown spots in the lips may indicate worms or may be a result of smoking habits. It is also important to note that Vata lips have a tendency to be thin and dry. Pitta lips are red and plump, while Kapha lips are often thick and oily. The organs most associated with the lips are the internal organs, lungs, intestines, thyroid, and heart. Eye diagnosis. Round, big, and beautiful eyes are of the Kapha constitution. Small, slanted, and those that blink constantly are Vata constitution. The Pitta eyes are usually sensitive to light and are lustrous to look at. A drooping eyelid may indicate a feeling of insecurity and lack of self-confidence to the beholder. Prominent eyes usually are a sign of hormonal imbalance or a dysfunction in the thyroid gland. In case one observes a white ring around the iris, it is an indication of too much salt or sugar in the body. Spots in the eye, especially those that are colored brown, indicate nutrients that are not absorbed in the body. Nail diagnosis. The Ayurveda principle believes that the nails are a waste product of the bones. The factors to consider when examining the nails are the following factors: contour, shape, size, color, and surface. It also helps to observe whether the nails are brittle, soft, break easily, or if they are even colored. Vata constitution usually has nails that are crooked, break easily, and are rough to hold. Pitta nails are soft, pink, or light colored, and have a tendency to glisten. The Kapha nails are thick, strong, and oily. A pale nail usually indicates problems in the blood or anemia. Yellowish nails are a sign of liver dysfunction, while bluish nails usually signify heart problems and circulatory disorders. The shape of the nails also indicates a lot of issues in the internal organs. Clubbed nails, heart ailment. Parrot nails, chronic cough. Bitten nail, nervousness, anxiety attacks. Bumps at the end of the nails, lung infections. Transverse groove, long-standing illness.